Heavy menstrual bleeding is common, affecting anywhere from 27% to 54% of people who menstruate. In this video, we will talk about this disease, hypermenorrhea, by answering these questions. What is hypermenorrhea? What causes hypermenorrhea? Symptoms of hypermenorrhea. How's it treated? What is hypermenorrhea? Heavy menstrual bleeding, HMB, previously known as menorrhagia or hematemenorrhea, is a menstrual period with excessively heavy flow. It is a type of abnormal uterine bleeding, AUB. You may have menorrhagia if you have periods that last longer than 7 days. Bleed so much, you have to change your pad or tampon every hour for several hours back to back. Need to wear multiple pads at a time to prevent leaking blood. Change pads in the middle of the night. Pass blood clots the size of a quarter or larger several times per day. Can't do your normal activities when you have your period. What causes hypermenorrhea? Menorrhagia can have many causes, ranging from hormone-related issues to medical conditions or medications. Hormone imbalances. The hormones that your body produces, like estrogen and progesterone, help regulate your menstrual cycle, including how heavy your periods are. Having a condition that causes your hormones to become imbalanced can lead to heavy period bleeding. Causes include anovulation, thyroid disease, polycystic ovary syndrome, PCOS. Weighing more than your ideal body weight can interfere with your body's hormone production and lead to heavy menstrual bleeding, too. Talk to your healthcare provider about your ideal body weight and if this could be contributing to heavy periods. Non-cancerous growths in your uterus. Benign growths in your uterus and conditions that cause cells in your uterus to grow improperly can cause heavy menstrual bleeding, too. Causes include polyps, fibroids, adenomyosis, infection. Infections, including sexually transmitted infections, STIs, can cause heavy bleeding. These include trichomoniasis, gonorrhea, chlamydia, chronic endometritis, pregnancy complications. Heavy bleeding can be a warning sign of pregnancy complications, such as miscarriage, ectopic pregnancy, C-section niche. Symptoms of hypermenorrhea. Symptoms of heavy menstrual bleeding may include soaking through one or more sanitary pads or tampons every hour for several hours in a row. Needing double sanitary protection to control your menstrual flow. Getting up at night to change sanitary pads or tampons. Bleeding for more than a week. Passing blood clots larger than a quarter. Limiting daily activities due to heavy menstrual flow. Feeling tired, fatigued, or short of breath as the result of blood loss. How's it treated? Treatment depends on what's causing your bleeding, how severe your bleeding is, your health, age, and medical history. Medicines for heavy menstrual bleeding may include nonsteroidal anti-inflammatory drugs, also called NSAIDs. NSAIDs, such as ibuprofen, Advil, Motrin IB, others, or naproxen sodium, Aleve, help reduce menstrual blood loss. NSAIDs may also make menstrual cramps less painful. Tranexamic acid. Tranexamic acid, Listita, helps reduce menstrual blood loss. This medicine only needs to be taken at the time of bleeding. Oral contraceptives. Aside from birth control, oral contraceptives can help regulate menstrual cycles and ease menstrual bleeding that is heavy or lasts a long time. Oral progesterone. The natural hormone progesterone can help fix hormone imbalance and reduce heavy menstrual bleeding. The synthetic form of progesterone is called progestin. Hormonal IUD, Mirena, Liletta, others. This intrauterine device releases a type of progestin called levonorgestrel. It makes the uterine lining thin and reduces menstrual blood flow and cramping. Other medicines. Gonadotropin-releasing hormone agonists and antagonists are also called GnRH medicines. They help control heavy uterine bleeding. Relugolix combined with an estrogen and progestin, mifembree, may help control bleeding caused by fibroids. Elagolix with an estrogen and progestin, Orion, is used to treat fibroid-related bleeding. Elagolix alone, or Elisa, may help control bleeding caused by endometriosis. Thank you for listening to all the information we want to introduce to you in this video. Do not forget to like, share, and subscribe for the HeInfo channel.